will be providing an update on the city's response to COVID-19 and rolling out the new city's vaccine dashboard. As of today, February 5th, 2021, Baltimore has had 38,412 reported cases of COVID-19. 374 people are currently hospitalized with COVID-19. ICU utilization is at 88%, and acute care utilization is at 87%. And we are now at 740 deaths from COVID-19 in Baltimore City. And while we understand how deep this issue still is, I am proud to say that we are still seeing a downward trend in our cases in Baltimore. Our positivity rate is down 52% over the 4 weeks prior to this one. We are, again, still have the lowest in the state. Our metrics are in a good place, which is a testament to how seriously our residents are taking this pandemic. Even as we started the process of easing some of our mandates, people are still taking it very seriously because people are still dying from COVID-19. It is imperative for each of us to continue to do our part in slowing the spread of COVID-19, especially as we roll into Super Bowl Sunday weekend. As a football fan, I know that the Super Bowl means a lot to all of us. And even though the Ravens are not playing and the hated Tom Brady is, we still have to make sure that we are being safe. As someone who loves each and every one of you and cares about each and every one of you, I cannot stress enough how important it is for you to stay at home on Sunday and limit your exposure to people outside of your household. We are also expecting maybe some more winter weather this Sunday, which we'll talk about in the future, in the next couple of days. But if you must be around people outside of your household, wear a mask, wash your hands frequently, and practice physical distancing. We know the pattern of events like this. We saw it happen New Year's, Christmas, Hanukkah, and what happened after that. Gathering with people outside of your immediate household for a few hours of fun means weeks of setbacks for our businesses, our restaurants, not to mention the health and well-being of our loved ones in the greater community. It has been 2 weeks now since our latest mandates were enacted, and I will be reassessing those over the next few weeks with Dr. DeRosa and our partners. The last thing that we all want to see is a start and uptick in cases and having to move backwards. Please be smart, please be safe, wear a mask, and follow all of the guidelines. With that, I'd like to turn it over to our Health Commissioner, Dr. DeRosa, to talk about an exciting announcement for us. Dr. DeRosa?
Good afternoon, and thank you, Mayor Scott, for continuing to lead and inform the public about Baltimore City's COVID-19 pandemic response. I'd like to briefly share the data of the key COVID-19 metrics here in Baltimore City. As of yesterday, as Mayor Scott mentioned, we've lost 740 lives to COVID-19. We've had a total of over 38,000 cases, and our latest 7-day average new case count is 155 cases per day. This is a 30% decrease from where we were 4 weeks ago. Our latest 7-day average positivity is 3.5%, a decrease of over 50% from where we were 4 weeks ago. Our utilization rates have decreased slightly, but they do remain high, with our ICUs at 88% capacity and our acute care units at 87% capacity. We've seen a slight increase in fatalities, now averaging slightly more than 3 deaths per day. Turning towards vaccinations, as of today, the Health Department has provided 7,940 first doses and 615 second doses for a total of 8,555 doses. In total, across the city, 43,829 residents have received their first dose and 15,046 have received their second dose. 7.4% of the city's population have now received a first dose. We're pleased to announce that this information, along with other aspects of our vaccination rollout in Baltimore City, will now be publicly available. Today, we're launching our COVID-19 vaccinations dashboard, a key tool for the public in keeping track of the number of vaccinations given here in Baltimore City by both the Health Department and other partners. As we have repeated throughout the pandemic, transparency in the health department's operations will be key in maintaining trust with the public. We encourage everyone to visit our website, coronavirus.baltimorecity.gov, where you can find a link to our public vaccinations dashboard that includes vaccination breakdowns by age, zip code, gender, and ethnicity. As we begin our second month of the vaccination rollout, I do want to take a moment to discuss what we know about disparities in race and ethnicity in COVID-19 disease, morbidity and mortality rates in Baltimore City, and here across the country. Like many other cities, we are seeing similar disparities play out in vaccination rates. To begin addressing this, we first want to start by just being transparent about those disparities, as indicated by our dashboard. As I discussed at the City Council hearing last week, our vaccination rollout plan details how we specifically will address these disparities, namely through expansion of our call-in for telephonic pre-registration, support of mobile vaccination clinics, and targeted messaging to populations at highest risk or with the most vaccine hesitancy. Similar to our testing, our mobile vaccination clinics will focus on areas hardest hit by COVID-19, starting with the focus on our senior housing sites. While supply remains limited, we anticipate future shipments will allow us to vaccinate approximately 50 to 100 people at these mobile vaccination clinics at a time. Though this sounds like a small quantity in comparison to our mass vaccination sites, the net impact of focusing our limited resources on the highest risk groups with limited access to sign up online or those with an inability to travel to mass vaccination sites cannot be overstated. Our goal is the equitable distribution of vaccines, and we will work to do this as rapidly as our supply chain allows. Additionally, we have begun planning community listening sessions to help with tailoring our message to specific groups and have been convening dozens of community partners to assist with widespread message dissemination. We know that this will be a long campaign for months to come and that we need to continue to build trust in our community around this vaccine. To reiterate, there are currently multiple ways that you can register your interest in a vaccine. Given the scarce quantity of vaccines, the local health department has been instructed by the Maryland Department of Health to focus our efforts on older adults, a population we know that has been devastated by COVID-19. For adults 65 and over who would like to be notified of appointments once they're available, we have a vaccination interest form on our website, coronavirus.baltimorecity.gov/COVAX, COVAX. If you are an older adult without access to the internet, you or a caretaker can also call the Maryland Access Point hotline at 410-396-2273 to be connected to help. When you call that number, a MAP ambassador will record your information for future outreach when a vaccine appointment is available. We know that there has been significant interest from our older adults who filled out that interest form by phone or online. We ask for your patience as several thousand older Baltimore City residents have already completed that form. We are working with hospital partners who will use that list of interested older adults that we've collected, and they will call those individuals to assist with scheduling at their clinics. If you have filled out an interest form or provided us information via phone, please be on the lookout for unknown numbers, and more importantly, please pick up the call. While we're not aware of any scams, please be vigilant. The vaccine is free, and our hospital partners will not ask you for credit card information over the phone. As a reminder, the health department is one of many vaccinators supporting residents in Baltimore. Local area hospitals and medical providers on Gov under Find a Vaccine have created their own interest forms for vaccinations when they become available. And residents in eligible priority groups are encouraged to visit those websites and sign up. Some Baltimore area Giant, Safeway, and Rite Aid locations have also begun posting their appointment links. Also beginning today, the University of Maryland Medical System and the Maryland Department of Health have begun offering vaccinations by appointment only at the Baltimore City Convention Center. Again, those slots at the Convention Center are by appointment only. At this time, all providers are offering vaccinations by appointment only, and I strongly discourage residents from attempting a walk-in appointment with any vaccine provider at this time. The health department's vaccination pod site at the Baltimore City Community College remains a second dose only appointment site until further notice. We will provide public notice when the health department has opened up appointments for additional first doses. We would like to reiterate that while we acknowledge the high demand for vaccines and first doses, Second dose appointments must be prioritized during these early days of the vaccination rollout and during times of vaccine scarcity to ensure that we have effectiveness of the vaccine. We ask residents, please do not forward any links that you receive from us to others when you're making your second dose appointment. First dose appointments sent to friends via social media or WhatsApp or any form not directly from the Baltimore City Health Department can't be honored at our Baltimore City Community College site. We know that vaccine demand is high right now, and with time and via collaboration with partners, we will vaccinate our communities rapidly and equitably. The Baltimore City Health Department continues to expand access points to vaccines throughout the city, with more information to come in the next week about the status of these operations. Information related to our vaccination rollout is available and updated regularly on our website, coronavirus.baltimorecity.gov/COVAX, as well as on our social media accounts. In the meantime, as Mayor Scott mentioned, please avoid large crowds, please avoid those Super Bowl parties, please continue to wash your hands, maintain social distancing, and wear a mask over your nose and your mouth in public to reduce your chances of disease transmission. Thank you.
Thank you, Dr. Duraza. Again, you can now go to coronavirus.baltimorecity.gov to see the vaccine dashboard for yourself. This is about being transparent with public health data and showing exactly where we are in a complex and at times a confusing situation. But let me also be clear. The numbers on this dashboard frustrate me. They make me angry, particularly when you look at who has received the first dose of vaccine in our city, broken down by age, race, gender, and ethnicity. This is not the fault of our health department, which controls less than 20% of the total vaccine that you see represented on that dashboard. Remember, we also have 11 wonderful hospital operating partners in our city, and many of which who are also providing vaccination to their healthcare workers and others. Our ability to dramatically change these numbers and make them more equitable is fully dependent on the state's willingness to partner with us on this. The tools that have been given to us in this rollout, the prioritization of people that has been dictated to us, and the unacceptable low supply we have been given is not allowing us to deliver the vaccine to those who are highest risk of contracting the disease. These numbers show exactly what you've heard Dr. Duraza and I and others constantly talk about for weeks. Equity must be at the center of this conversation. We need the support of the public, our institution, our business community, everyone's buy-in to advocate for a more coordinated and equitable system at the state level. Otherwise, we will continue to see an inequitable distribution and unacceptable low supply. We have a long way to go. Now, we know the state has set up a new mass vaccination site at the convention center that began operations today, and we are grateful for that. Just like the testing operation at that site, the appointment process will be managed by our partner at the University of Maryland. And per the state guidelines, this site will vaccinate people from within Baltimore City, in addition to those from outside the jurisdiction. We know the tools and resources currently supplied to us by the state, including the online-only PrepMod system and vaccine supply, are inadequate. While we are thrilled about the addition of that mass vaccination site, I remain concerned that the resources will not support our highest need residents. That's exactly why I wrote the governor earlier this week to ensure that in expanding our capacity to vaccinate, that we're also prioritizing those in our immediate community who must and need their vaccine, including the more than 15,000 older adults who have already expressed interest in making an appointment. They should be prioritized at that site. Our teachers in Baltimore City School, they should be prioritized at that site. And all Baltimore residents who are eligible but have struggled to get their first dose because of the limited supply. I've also asked the governor to give Baltimore City as a jurisdiction a visibility into the percentage of Baltimore City residents that have accessed state-run sites, including the one at the convention center. Right now, we do not have access to this information. And while it's important to get this vaccine to as many people as possible, we must be steadfast in our focus on equity and ensuring that Baltimore residents can access the vaccine as new facilities and vaccine resources are deployed in our jurisdiction. We know that people are coming from all over the state to use our vaccine sites. And although Baltimore continues to experience the same issues as our fellow local jurisdictions and jurisdictions across the country, things are changing day to day. This is not simply a Baltimore issue. This is something that my fellow county executives are also frustrated with. I am cautiously optimistic about the steps that President Biden is taking, but I'm focused on what's in my control here in Baltimore today. Let me be very clear in saying that the city is, again, only giving second doses of vaccine. Those doses are earmarked that way by the state of Maryland. We are fully prepared and moving swiftly to vaccinate Baltimore residents as rapidly as the supply allows. Again, I am encouraged about the great demand for the vaccine from our residents. It shows that people care about taking the necessary steps to protect themselves, their family, and our community. I want to assure you all that I will not stop advocating for additional vaccine resources, and I will continue alongside the Health Commission to stress equity in this conversation. We have older adults who can't access online-only systems. We have non-English language speakers and people at different literacy levels who are struggling to access the system. We have a system that's prioritizing the most technologically savvy individuals and leaving others behind in a city that we know has a deep digital divide. We can see from the vaccine dashboard that we need stronger coordination and a focus on equity to ensure our most vulnerable residents do not end up at the end of the line. And at this time, we're going to switch gears just a little, and we're going to bring up Commissioner Harrison to talk about and give an update on public safety. Thank you.
Good afternoon, and thank you, Mayor Scott. The men and women of the Baltimore Police Department continue to be laser focused on those responsible for violence in our city. We are still actively pursuing 32-year-old Marquise Poteet, who was wanted for first-degree murder in the senseless killing of MTA bus driver Frankie Duckett last Friday. In addition to Mr. Poteet, we are asking for the public's help in assisting us in our efforts to remove violent offenders from the streets of Baltimore. We are looking for the following individuals wanted for heinous crimes such as murder, rape, and armed robbery. 41-year-old Lenny Epps, wanted for a triple shooting and homicide that occurred on January 23rd in the 600 block of North Lakewood Avenue. 30-year-old Sean Williams, wanted on 4 open warrants to include assault and burglary. 27-year-old Christopher Jones, wanted on armed robbery. And 19-year-old Zaid Boyd, wanted on warrants to include armed robbery. If you know the whereabouts of Mr. Poteet or any of these suspects, we are asking you to call our Warrant Apprehension Task Force at 410-637-8970, or those who wish to remain anonymous can call Metro Crime Stoppers tip line at 1-866-7-LOCK-UP. So far in 2021, we have arrested 36 repeat violent offenders for handgun violations, with a total of 99 illegal gun arrests this year, which is a 29% increase from last year. Now, earlier this week, we announced the arrest of 20-year-old Jamil Giant for the shooting of 2 females in December in the 1800 block of North Mount Street. We know that at this time, this case is an isolated incident that resulted from an argument that escalated into gunfire. As I have stated before, Mr. Giant's decision to pull the trigger was really made when he acquired the illegal handgun. So those carrying illegal guns in our city must find positive solutions to solve their conflicts instead of pulling the trigger. We remain laser focused on those illegally carrying guns on our streets while using crime gun intelligence to identify the source of the illegal firearms. We will continue to work with our city leaders, our state, local, and federal law enforcement partners, and our community to make our city safer. Thank you. I'll turn it back over to our mayor.
Thank you, Mr. Commissioner. And I want to simply say again that if you know with the whereabouts of these individuals, Mr. Poteet and others, and many of the other videos and requests from health from BPD about bringing families justice and some sense of peace, please let us know. We cannot allow these folks to gun down folks driving buses and otherwise in the city and be comfortable. Please let us know. We will not stop looking for you. We will continue looking for you, and we will bring you in, but we want folks to step up and help us as well. And now we'll take a few questions.
2 questions from Dave Detling, WMAR 2 News. First, Mr. Mayor, can you address the move to virtual pressers versus in-person pressers, which your administration was previously holding? Second, in relation to your letter to the governor, have you received any further communication in your request from the state? Will the health department be taking into account the decision to cancel vaccines at BCC and its positivity on future positivity rates and its impact on future positivity rates?
I think that's 3 questions, but the first one, Dave, is simply today's presser. We're going to have some more of those virtuals in the future. We will have in-person pressers, but we were displaying a website today. This is the reason for the move today. I'll let the health commissioner come up to answer the question specifically about the moves as far as the operations. But we did receive notification from the governor that they received our letter, and they look forward to talking with us about the issues further, and we are grateful for that and looking forward to doing so. Madam Commissioner.
Yeah, I'll add, as a part of the letter to the governor, I know that Mayor Scott had indicated that anyone that was in phases 1A through 1C that had trouble accessing be given priority at the convention center site that's opening today. And again, that includes the group that showed up initially to the Baltimore City Community College. Again, I'd also just reiterate, we want to, again, maintain the integrity of the process and make sure that we can vaccinate everyone who requires a second dose, and that's what we'll be doing for this month.
Question from Mackenzie Frost, Fox 45, for both the mayor and Dr. DeRosa. The explanation for the Zeta Center testing site does not match the weather yesterday. Was it a weather concern or staffing issues that caused the testing site to be canceled on Thursday?
Dr.
Is
DeRosa.
there a concern about skewed COVID data with fewer people getting tested?
Dr. DeRosa, I'll let you answer that. I answered that question earlier today.
Yeah, so the concern was actually related to the conditions throughout the Zeta Center, right? So we understand that there's a parking lot and there's an icy condition. We have many older adults. It is a senior center that come to that site. So we wanted to make sure that the actual location outdoors was safe before bringing individuals. It was not a staffing issue. As far as skewing positivity, again, there's more than 5,000 tests being performed in the city on average per day. This number has remained relatively high, even as we're seeing more vaccination sites. So our positivity rate today is the lowest it's been in some time. So I feel great about where we are actually in terms of positivity.
I think just to follow up on that before we go to the next question, I think, again, the bigger story that we should be talking about here when we talk about testing and positivity rate is that our rate is down 52% over the last 4 weeks, and that we have the lowest in the state. That should be the story about that. And while the testing is still going on, even though folks are being vaccinated, again, Baltimore has the lowest positivity rate, and we're down 52% over the last 4 weeks.
Last question from Jane Miller, WBAL. Has the city considered setting up a vaccine site such as the Timonium site in Baltimore County, which seems to be serving significant numbers daily?
I'll let the health commissioner speak to that.
Yeah, so as we were planning for our mass vaccination sites, we considered many models. Certainly the Timonium site has the advantage of having extensive amounts of parking. When we think about locations throughout the city, we are a little bit challenged in terms of space. But can certainly appreciate that Timonium Fairground site can accommodate a lot more people just from a space perspective. Again, when we're planning, we're also considering the ability for people to be socially distanced within a large space, which is why we've gone with, Port Covington, which had a lot of space, in Baltimore City Community College. But parking and ability for people to access is also very important.
Thank you. Thank you, everybody. Thank you.